Hello and welcome to your Guava profile. This demo will give you a bird's eye view into just a few things that you can do with Guava. First, this is your profile page. Whenever you go to Guava, whether it be on your phone, your tablet, or your computer, your profile page is where you'll enter from. On computers, you'll see on the left-hand side a navigation bar. If we go over there and we click Basic Info, it will start to scroll us to those sections. Within Basic Info, you'll see your name, your age, your date of birth, your sex, your height. You can even see where you fall compared to the norm for your age and sex. Next, let's head over to the Biomarkers section, which is a super informative part of Guava. If you click into, for example, heart, you'll see different biomarkers that relate to heart conditions. If we click into HDL cholesterol, or otherwise known as good cholesterol, you'll see where you currently fall compared to the normal range. As you can see, we're borderline low here, where that information came from, when it's from, and then you'll also see an overtime graph where you can hover and see all of the different inputs where this information is coming from. In addition to this, you can see other factors that can impact HDL cholesterol levels. You can click on the All Metrics tab to learn more information on different biomarkers that you have in your medical records. For example, you can organize by heart health or blood sugar or blood function, or you could even switch to lab test view and look at information that way. Like on the profile page, you're able to click into each biomarker to learn more and see overtime information. For example, we can click into total cholesterol, see what your most recent levels are, what that means, where the information is coming from, and see trends over time. Next up, we have the medications and supplements section. This is a really great area to keep track of all of the different medications or supplements that you have given to yourself, let's say vitamin D supplements in the morning, or that a doctor has prescribed to you. Medication information can be one of those things that can be really tricky to keep track of, but so important for both you and your provider to stay on top of. Having up-to-date medication information can lead to better quality of care and reduce the number of prescriptions over time. Information listed in the active medications list was either manually entered by you or was added by one of your providers through one of your patient portals. You can see the name of the medication, the source, and the last confirmed or last taken date. You can edit the listing to modify whether the medication is no longer active, and even write in side effects for your reference and for future providers to see. All of this information is not just good for you to be aware of, but relevant whenever you see a provider as well. Next up, we have symptom tracking, which is a very powerful tool. You'll be able to log various symptoms and the severity of them, as well as write notes about them. You can then see overtime data and how they compare, whether they're getting worse or whether they're getting better, and whether certain foods or medications are impacting them. By logging things in Guava, such as medications or food or symptoms, you can compare overtime data to see what is influencing what. Under the Conditions and Injuries section, you can see active conditions as well as conditions that are no longer active. You can see where the information is coming from, so the source, and the start date as well. Like medications, you can edit this section. So what that means is that you can list whether or not one of the conditions listed is something that you are currently managing, or whether it's something that you previously managed, or alternatively, maybe it's in your patient record, but it's not something that you remember having at all. Doctors make mistakes, so it's possible that you didn't actually have this condition. It's good to modify in your Guava profile. The rest of the profile page is pretty self-explanatory, with an allergies section, which this individual doesn't have any, a vaccination section where it shows you the list of immunizations you have and information if you want to learn more, as well as an events section, genetics section for something like a 23andMe report, lifestyle, for example, how much coffee you drink on any given time period, and then cycle tracking for females. Before we move on to other parts of Guava, I want to quickly highlight how easy it is to manage your medications. For example, for this particular profile, you can see the frequently used or added medications such as the daily multivitamin, the simvastatin, or the Renew probiotic and prebiotic, and you can also see the last times that they were entered by the individual. To quickly log a medication, all you have to do is tap the medication under frequently used, or alternatively, you can type in the medication, see the list of known medications based on your active medication list, or alternatively, you can type in a new one and log it that way. Then press Add. If you go down to the medication and supplement section, you'll notice that the aspirin and the simvastatin that you've just logged before shows up under your medications taken today section. On the records page, you can see all of your medical records in chronological order and organized. You can see your imaging reports, like this one, and financial statements as well. Like on the profile page, you can click into biomarkers to see over time information and factors that influence them. And you can also filter based on source of the information and type of information. Another neat thing about Guava is you are able to search through your records. For example, with this profile, if we type in diabetes, it'll pull up all the records that mention diabetes, whether that information is coming from manually entered data or coming from a patient portal. You can always add more sources from the Sources page. You can connect to more patient portals from the Health Systems tab by quickly typing in the places that you've received care and then logging into the patient portals via the Connect button. You can also connect your fitness or medical devices from the Fitness and Medical Devices tab and upload documents by either snapping a quick photo of them or by uploading a PDF or an imaging record. To share your Guava profile with loved ones, caregivers, or providers, click the Share Profile tab. You can then quickly share by email by selecting that button, choosing the email address you wish to send your Guava profile to, select the permissions, how long that they have access to, and then press Share. Guava is a simple, secure, and modern way to organize and keep track of you and your loved one's health. With our Guava Emergency Card, we provide another layer of security to you and your loved ones by making relevant medical information readily accessible in case of emergency. First responders are trained to look for the symbol on the top left corner of this card in emergencies. We worked with first responders like EMTs, nurses in ER rooms, and MDs in ER rooms to make sure this card is valuable to them and that it has all of the relevant information needed to treat you during an emergency. For more information, don't hesitate to email us at hello@guavahealth.com or visit our website at guavahealth.com to learn more.